This is the third in a series of 3 recap briefs covering the Think Summit series on access to care by Petal Health. This specific brief focuses on the BC event, while Brief 1 was an overall series overview and Brief 2 focused on the Ontario event. We'll cover some of the high-level outputs of the BC Summit, but you can get all the detailed briefings and artifacts at thinksummit.ca/artifacts YVR. This event took place in the fall of 2025 and involved dozens of leaders from all across BC's healthcare system, volunteering their time to come work together and try to surface new ideas on how to solve the access to care challenge. And there were a lot of very compelling ideas. And it's useful to kind of look at what got votes from the group and it kind of made it to the top. Because some of these are really interesting, like payment reform or outcomes-based KPIs, which actually circles back to payment reform, or embracing private-public collaboration, something we saw come up in Ontario as well, and mandating data interoperability, another thing we saw come up in Ontario. But what you got, if you got the zeitgeist of the whole room, was a real bias to action, just like the group in Ontario. These are people with a passion to try to solve this problem. There were many do mores, a handful of do less, and of course, as a group, there was voting and discussion to try to raise the ones that mattered most. Things like building a simple and clear set of key performance indicators specifically focused on access to care, or insist on system-wide visibility into the access to care graph. That came up in Ontario too. We don't have clear KPIs, we don't have a clear agreement on what success looks like, and we don't have visibility into the gap. How are we supposed to fix this? Then there's things like aligning payment and funding and mandating data interoperability. So many things that were very common across both of the summit events. There's a really interesting discussion that really brought out a lot of passion, and that was defining what great looks like when it comes to access to care. And how do we measure that? And what do we need to mandate to give us visibility into that? It was a huge theme with the basic understanding, like we can't fix this thing if we can't agree on what great looks like and we can't see how we're doing. And when it came to all the discussions around what to do less or what to stop doing, there was some great conversation. But one of the things that was really interesting is this notion of we've got to stop assuming that adding more and doing more is always the right prescription. Sometimes stopping is the right prescription. The punchline, if we were forced to distill the whole day's discussion down to one thing, would be the need to align on what success looks like for access to care, and then align execution and remuneration and so on that definition. But just to focus on the idea of you can't fix it if you can't agree on what great looks like. Everybody knew this would be hard, but without it, how do you actually close the gap? Well, that's a high-level overview, and I would really encourage you to go to the thinksummit.ca site and dig right into the details, because there were really, really insightful conversations. But first, I just want to thank everybody for volunteering their time and not just bringing their experience and their opinions, but their passion. Unlike typical events where people show up on behalf of their organization, these people came as individuals and they were free to express their opinions, and boy did they. And thank you to the people who attended and participated, and to Petal for agreeing to make all of the briefings and all of the artifacts that came out of the Think Summit series open and available to anyone with a passion for helping to solve Canada's access to care challenge. As a reminder, this is the third of 3, so Brief 1 was a series overview, Brief 2 was on Ontario, this was on BC, and next up we're going to do a bit of a share around how the learnings from the series so impacted our thinking that we had to completely retool our formal thesis on healthcare in Canada. What did we learn, and how did that impact our foundational thinking? Anyway, that's for another day. Thank you and have a wonderful day.